Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is a compilation of several ear infections where the patient has what we call otitis externa. So the otitis externa is the medical term given for an infection of the outer ear, which consists of the satellite dish, the cartilage satellite dish that we all have on the side of our heads, the ear canal, and the outermost membrane of the eardrum that's facing towards us when we examine the ear. So that is what makes up the outer ear. And patient one has, you can see a lot of inflammation as well. The ear canal is really swollen and they've got all this dead skin and debris, and they're in a lot of pain as well. And we think their outer ear infection is due to what we call swimmer's ear. So if you've been following my channel and watching my videos and listening to my narrations, you know that I'm really anti-water in the ear. So water can trigger an ear infection, and that's for anyone really. So I don't know the exact percentages, but I think approximately 5% of the population where if you were to get water in the ear, you can either get trapped or it can then lead to an infection. And 5% is actually quite a high percentage. So I'm always advising my patients, and obviously through my videos online, trying to advocate to avoid water entering your ears. And there's several ways you can do that, which I'll discuss in a moment. And you can see I'm just getting all this debris out. There's a lot more than I anticipated. And this is the final piece of debris, very deep in the ear, can only just get the sucker in, as you can see. So now I've cleaned the ear canal, the eardrum is visible, it's intact, and it looks pretty healthy. But I'm just going to use a fine end suction probe now, and I'm just going to start just mopping up some of the debris as much as we can. Now, it's not possible to get every little last speck out from someone's ear. We'll be there for hours and hours, and it will be uncomfortable for the patient. We've cleared the debris. Even if we left it as this, we'll be happy with this. And the patient will now use some antibiotic spray, hopefully from their GP, which will resolve this infection. So the ways you can avoid water entering your ears, you can get some custom-made swim plugs. They're probably the most effective. So an audiologist or ear specialist can take an impression, similar to when you have dental impressions done, of your ear, and using that impression, that cast, they can then manufacture some hypoallergenic silicone swim molds. So they go into your ear and they form not only an acoustic seal but also a watertight seal, so that you can just avoid water entering your ear. And they're custom made for you, so they should fit like a jigsaw piece in your ear. One of the negatives of custom swim molds is that if you are a chronic sufferer from earwax, which approximately 5 to 8% of the population are, it can, because with custom swim plugs, we generally make what we call the meatal tip. That's the part of the mold that goes into your ear, because this custom mold not only fits in your ear, but it also fits on the external part of your ear, where the folds and creases are. So the meatal tip, the section that goes into your ear, if you are a chronic wax sufferer, it can further impact it. You can also just get some foam or silicone over-the-counter swim plugs that you place in your ear, and they expand and create a seal. So I'll come back to that. So we cleaned the patient's left ear. This is the patient's right ear. That was fine. There's no infection there. So this is patient two. This is their right ear, and you can see they've got a lot of debris near the probably midsection of the ear canal, and they've also got a lot of debris and dead skin on the eardrum. So we're just going to perform microsuction and clear that. So the foam and silicone plugs, they go into your ear. So you kind of, with the foam ones, you pinch them in, put them in your ear, and they expand. And with the silicone ones, you almost kind of gently rotate it and turn it into your ear. Now, they can be effective, but for some people's ear anatomy, they just don't fit. So it's not for everyone. You can now get this swim putty. So it's some putty that it's malleable. You can adjust the shape and form your own shape and size. And with that, you don't actually put it, well, you can put it slightly in your ear, but not too far. So obviously you have to pull it out, but you can just position it at the entrance of your ear to form a seal. They're probably not as good as staying in the ear, but if you are a wax sufferer and you don't want things going in your ear, they're an alternative. You can get swim headbands. So again, they're probably not 100% effective, but it's better than nothing. So it's a headband and it goes over your head, and then there's a section that when it goes around your head, it goes over your ears. And then you've got sprays. There are certain sprays, some olive oil and tea tree oil sprays. So the olive oil acts as a hypoallergenic layer when you squirt it in the ear, so it helps to repel water. And then if there is any bacteria in the ear, the tea tree has got some antimicrobial properties to help counter that. But again, I'm more of a fan of avoiding the water entering the ear in the first place. If you do get some water in the ear and it's not draining, just tilt your head to the side. You can get some drops. These drops contain glycerine, so it's almost like an alcohol solution, and a very mild alcohol, and it helps to repel water out of the ear. And there are some that actually contain lidocaine as well, so that's a surface anaesthetic to relieve any pain. And then you can get acetic acid spray. So acetic acid spray just helps to reacidify the ear. When you get water in your ear, it can wash away the natural acidity of the ear. And the acidity is important. Our natural ear pH is around 5.4, so it's slightly acidic. But when you get water in your ear, it can wash away some of the natural acidity. So using an acetic acid spray over the counter designed for the ear can just help reacidify the ear, and that helps prevent any infection forming. Again, it's not bulletproof, but it's in combination, all these little things can help us. This time of year, we do see a lot of ear infections because it's the hot summer months and people are going on holiday in swimming pools, etc., and getting water in the ear. So it's not uncommon during these winter months that we're seeing a lot of these cases. So I've cleared the majority of the blockage. Just again, we could leave this, but patients here, let's just see if we can get it out without kind of causing any discomfort, which we were able to. So just hovering over the canal wall here as much as I can without making contact. You see it's much, much healthier already. See the whole eardrum. There's a bit of skin just posteriorly. We're going to see if we can just hover over that. Again, we've referred the patient to their GP because they will need some, despite clearing the ear, they will need some. When we perform microsuction, we get rid of the debris, what we call otalgia, and any dead skin, but their ear is still infected. So they do need to still have the appropriate prescribed medication. This is patient 3. Again, I think once again this was due to water getting into the ear. So this is a bit thicker, this discharge, and a bit more watery as well. So it wasn't as dry as the first patient. It's a bit more liquid, but this liquid is quite thick as well. So, and they have got a bit of a narrow medial section of the ear canal. So when we say medial, we mean the part of the ear canal towards the eardrum. It does narrow a bit. And it is on the drum, so we're just hovering over, and I'm actually using the big sucker, and even with the big sucker, it's quite hard to get this off the eardrum. You just probably saw there that this part of the eardrum just flexed a bit, so we're just going to be gentle. You can see again, the eardrum just flexed, and that's fine. Patient didn't actually feel it. So I think I'm going to use a fine end now to see if we can get some of these smaller bits off. So you can see it's collected at the little pit at the bottom of the ear canal. So the ear canal, as it goes towards the eardrum, it narrows and it widens back out. And that narrowing and widening of the ear canal, around 0.5 centimetre away from the eardrum, it creates a recess here. We call that the inferior recess. So it's like a little base and a pit at the bottom of the eardrum where quite often you can get water or discharge collecting. And that can slowly erode that part. So if you have an infection and it settles in that little trench, it can start eroding the bone there and creating a bigger dip. And we call that widening the annulus. And then you also get an alcove here. This is the anterior recess, and this is probably the most difficult part of the ear to get access to. With the microscopes and head loops and even the wax scope, because it's not an endoscope, sometimes you can't actually even visualise in that region or actually inside the inferior recess of the ear canal. And this is where an endoscope really is out there on its own, I feel anyway, in terms of optics for clinical ear care. So again, we can just angle down and into the inferior recess. And once more, we're not going to get every little last speck out. I just want to get as much out as possible. Quite often patients with ear infections, they are already experiencing earache, so what we call otalgia. So quite often patients ask, is it going to be uncomfortable? And we have to level with them, say, your ear's already uncomfortable, you're already attending with pain now. I will of course be as gentle as I possibly can and not to kind of add to that pain, but given that your ear is already painful, do expect some discomfort, but it shouldn't be unbearable amounts. And if it is, do obviously let us know. The patient was fine, we did as much as we can. Now this patient does suffer from chronic ear infections, so it's kind of almost perennial actually, it's almost every year. So I'm just trying to hover over the base here. I don't want to touch the canal if I can avoid it. So what's happened here, the skin is almost puffed up. So it's not peeling away, it's embedded and it's just puffing up when we're vacuuming. So this will kind of just need the antibiotic treatment really to resolve that. But you can see the eardrum now. Yes, there's a bit of remnants here and there, but they can at least hear now. If you look at how occluded and blocked this ear was right at the beginning, it's much, much clearer. So I'm really happy with this as it is. And the rest of it will, the antibiotic ear spray treatment will help. So you can see the eardrum patient's very grateful. Well, I hope you enjoyed that little compilation, guys, and I hope you're all keeping well and safe. And yeah, stay tuned and remember, be nice and be kind. Thank you. Bye.